Thanks for staying tuned. This is still Spotlight Africa coming to you live from Uyo. We move on to an interview segment where we have Dr. Abia Dan Abia joining us this afternoon. With the WHO declaring the human metapneumovirus as a new global health concern, myths are flying around and several more concerns of the risk of the widespread of the disease, which started out in northern China, killing children under the age of 13. Children under the age of 14, I beg your pardon, mostly being affected by the rise of this disease. First discovered in 2001 in the Netherlands, conversations are growing about this. Should Nigeria be worried? How worried should Africa be? Good afternoon and welcome to Spotlight Africa, Dr. Abia.
Yeah, good afternoon.
Good to have you on the show. So,
Thank you very much.
it looks like the medical world has a new issue on their hand. We're still grappling with conversations around COVID-19, and then there is the HMPV, which is now a growing concern. Would you like kindly take us through what the major truths are about the HMPV?
Okay, I'm talking about the human metapneumovirus. Like you already highlighted, was discovered in Netherlands 2001. Basically, it's a virus that attacks the respiratory system. Okay, and it's very severe in children, older older adults, and people with a weakened immune system. And those that are at risk are basically those that already have a compromised respiratory system. That, like, I mean, those that are asthmatic or have what they call COPD. Those are the ones that are at higher risk of mortality from this virus.
Okay, so
Basically, come again.
no, go ahead.
Yes. So, well, unlike there's as we are aware, there's an outbreak of it in China, and I feel and I believe Africa and Nigeria, we should take proactive steps to work on preventing the outbreak here too.
So how easily can the HMPV be transmitted from one person to the other? And another question I would like for you to answer with that is the HMPV closely related to COVID-19? Because we also must treat the myths coming out with this particular disease at this time. Is it related to COVID-19 or are they far apart?
Basically, the first question. Let me take the first question. You said, how is it transmitted? Basically, it's transmitted through close contact with persons that are infected with it already, through what they call droplet transmission. Meaning, if you're close to someone that's maybe sneezing, coughing, and the person is not real well covered up with a mask, you can easily get infected. It can also be transmitted through contaminated surfaces. When getting in contact with a surface that was already contaminated by the virus, that way someone can be um, infected by the virus. Then the second question you asked, if it's closely related to COVID, the similarities they have is that they both attack the respiratory system. But I would say, and that the this other virus is not as deadly as COVID was so far. It is very dangerous. It is more dangerous with those that already have a compromised respiratory um, tract issues, basically.
So, at the base of this HMPV, what would you say is the cause of the disease? Because maybe, for instance, malaria, we know that if you're bitten by, a female mosquito as it is, it transmits the virus onto you. What is the background of the HMPV? What's the cause?
Okay, it's caused by a certain family of virus that's that attacks the respiratory. Can you hear me? Hello.
Loud and clear, we are with you. Go ahead.
I said the virus itself is caused by a family of viruses that attacks the respiratory system. A family of viruses called pneumoviridae is a single strand RNA virus. Okay, so when these viruses or this virus itself comes in contact or finds its way to the respiratory tract, it replicates there and now causes symptoms of runny nose, cough, sneezing, headache, fatigue, sore throat, shortness of breath. It typically attacks the respiratory system, similar to what COVID virus did then.
So is this closely related in any way? Because we know so far it is China that has been reported to have been highest hit in the emergence of the HMPV. But there is also a flu attack in the United Kingdom that has seen over 5,000 persons being admitted, and emergency wards in hospital are overwhelmed. Is there any close relationship with the HMPV at this time with what's happening in the UK?
Please, I did not get your question again. Can you be clear, loud a bit, please?
Okay, so I'm asking about a flu that has also broken out in the United Kingdom. It has seen over
Okay.
5,000 emergencies so far. I'm asking if the HMPV has any relation with that flu. It's termed as a flu, but just as you mentioned earlier, part of the forms, part of the ways that
If I get your question, if I'm getting your question right, you are asking if there's a close relationship between the HMPV virus and influenza.
yes, and the flu currently going on in the UK, yes.
Yes, well, they are not closely related. Influenza is quite different from the HMPV. Although the presentation in terms of symptoms are slightly similar, but of course they are really differentiated after a test is done. During serology or PCR lab test, it can be really differentiated because definitely the virus will be isolated when that a lab test is done. But they are closely related in terms of their symptoms, signs and symptoms, the way it presents in a patient.
Okay. In the face of this, how ready do you think that Africa is? Several national centers for disease control across different countries, including Nigeria, have sent out statements of their readiness and their alertness with regards to the HMPV. Do you think that Africa is ready comparatively with what happened during the COVID era?
Okay, basically, I think after Africa survived COVID-19, the things were put in place for pandemics and epidemics like this. I believe it's just to activate Africa. Yes, I believe it's just to activate certain protocols and be more conscious. What do I mean by protocols? Or at this point, we know we don't have a vaccine yet for H for this virus, HMPV. There's no known vaccine yet. Although we've now had vaccine for COVID, but we don't have vaccine for this yet. So, but being vaccinated has gone a long way to show that if you've been vaccinated previously, it's also the research has showed that it has gone a long way in also helping the, to then things like vaccination. When the vaccine comes, I think they should work on making a vaccine for this virus. Then practices like good hand washing of the hands, using of hand sanitizers should be activated, meaning that there should be public awareness on the usage of hand sanitizer, washing hands regularly, improved ventilations, trying to avoid crowded places, activation of the usage of face masks should be done. I believe if Africa put some of these things back in place, just protocols similar to what was in COVID-19, it will go a long way to reduce the spread, even if there's an outbreak here.
Okay. I believe that same goes for Nigeria. But two key things before I let you go this afternoon. as Africans will already be, and the world over, the COVID-19 experience wasn't something a lot of people, like to remember. There are conversations about a possible lockdown. That's a 2.0 of a lockdown. Is there possibility of the HMPV, virus escalating in terms of spread? And is there possibility that the world may be experiencing another lockdown?
Yes, everything depends greatly on the government of each of those countries and how they are ready to battle. Like in Africa, per se, everything really depends on the government and the Center for Disease Control, how tireless they are going to be able to combat this. Because you can, when there's an outbreak, you never can tell. There's always, like we had in COVID, there were cases of replicating and all of that. So if an outbreak comes, we don't know to what extent it will go, but I believe that this responsibility solely lies on the hands of the health institution and the government to create enough awareness to activate, safety protocols to fight this outbreak
Okay.
from escalating.
Okay. So one last question. There are also conversations because the worst scenario for this kinds of epidemic is for wrong information to fly around. Now that there are also concerns as to the fact that the HMPV seems to be a virus that was fabricated in a laboratory in China. You know how Nigeria goes. These conversations are prevalent, on our street, and if we are not careful to curb them, they will spread and affect people's acceptance to possibilities of vaccines and other preservatives that may be coming up. What's your thought about this?
Where the virus was created, I can't categorically say for sure, but of course it was already isolated as far back 2001 in Netherlands. So, but you know that when there's an outbreak like this, there will be a lot of controversies, a lot of hearsays, and all of that. But the fact is that this virus has been isolated. We know what we are dealing with. So I believe that a proper public awareness should be created, a proper channel of which information, the right information gets to the public should be done so that people are not misinformed. Then, if those protocols I've mentioned previously in this interview is activated, it will go a long way, like to stop the spread. Things like face masks should come back to light again. Things like washing hands, you know, things like staying off crowded areas. If all those things are activated again, it's just a matter of reminding the public, just like we reminded the public during COVID-19 that, okay, this thing spreads this way. Facilities, both government and private facilities, put things in place like providing hand sanitizers for visitors to, that visit their facility. Things like that, awareness. Both signboard to direct people on what to do, how to wash hand, how to wear face, things like those protocols will really go a long way again. So, like I said earlier, the protocol COVID-19 protocols should be activated because it's still similar. Respiratory tract is involved. The respiratory system is involved again, just like in COVID.
All
So
right.
the preventive measures should be activated, and that way they will be able to um, stop it from spreading
All right,
like
thank you
wildfire.
very much. Thank you very much, Dr. Dana Bia, for coming on the show. I do hope that hospitals around the nation and in Akwa Ibom State are ready, and we wish all the best to our medical personnel all around the world at this time. Usually, you're the first hit and the worst hit. Thank you so much for your time on Spotlight Africa.
All right, thank you, and have a wonderful day.
All right. To wrap this up, a prominent Nigerian atheist who has just been freed after serving more than 4 years in prison for blasphemy is now living in a safe house as his legal team fear his life may be in danger. Mubarak Bala, who is 40, was convicted in a court in the northern city of Kano after, in a surprise move, he pleaded guilty to 18 charges relating to a controversial Facebook post shared in 2020. Nigeria is a deeply religious society, and those who may be seen as having insulted a religion, whether Islam or Christianity, face being shunned and discriminated against. Blasphemy is an offense under Islamic law, Sharia, which operates alongside secular law in 12 states in the north. It is also an offense under Nigeria's criminal law. Bala, who renounced Islam in 2014, said there were times during his incarceration that he felt he may not get out alive. He feared he could have been targeted by guards or fellow inmates in the first prison he was in Kano, which is mainly a Muslim city. Well, that's all we can cover on Spotlight Africa today, bringing you news all around the continent. We do hope that you're able to stay safe out there in the face of the HMPV. My name is Uyai Emem. Thanks for being a part of Spotlight this afternoon. Follow us across all social media platforms at SpectrumTVLive.ng. Good afternoon.